Defacto Gazette is a weekly publication of independent political and economic news analysis by the economist Jargal. Our gazette is published in Mongolian, English, Japanese, and Russian. Please order your subscription online at www.jargaldefacto.com or from the post office called Mongol Shudan near you. Also, you can order by phone at 7007 8916.
One is the fund of future.
Good evening. Welcome to Defacto Review, our weekly in-depth analysis on the current news and affairs in Mongolia. You can join in on our conversation on MNB World Facebook page and on Twitter with hashtag Jargal_Defacto. Now onto our topics for today. Coronavirus and the world's attitude. As for our second topic, we're going to talk about coronavirus and Mongolia. And lastly, we will talk about coronavirus and vaccine and treatments. So this week we are going to review the coronavirus cases around the world, and we have today in our studio Mr. Batbayr from the Transparency International Mongolia's Health Advisor Program, Advisor on Health Program. So coronavirus originating in People's Republic of China is a major issue on the world scale, and it's a really big problem as of now. So number of cases are increasing every day, and we are going to talk about the world's attitude towards the coronavirus as our first topic. So first of all, our first question is, I think we should start on giving the audience small information about what is a virus and how does it differ from, maybe bacteria and other infectious disease causes.
Yes, it's very important to differentiate bacteria and virus. The virus is maybe thousands times smaller than bacteria in terms of size, and it's also different compared to bacteria. Virus is actually, we could call it the organism which lives inside the cell of the human. So it's more like parasite. Bacteria, it has all the structure of the cell, unlike the virus. And virus uses human cells infrastructure to replicate. So it's two different structure.
I see. So you graduated the London School of Hygiene and Tropical Medicine, so you are expert in this field. So could you tell us about how is the outbreak of COVID-19 viruses affecting the world itself? Did it actually reach the level of pandemic as of now?
So it's up now as World Health Organization's new classification. So they classify this as a high risk. So they did not classify it as a pandemic. Right. So if it's pandemic, it's already the situation where they're losing all the work to control it. Now they have to work to make sure that how to reduce its risk and reduce its danger. Right. But WHO says they did not reach that level. So they classify it as a high risk. This means there is high risk countries and there is fight is happening and they're trying to control and they're succeeding. So I also, a specialist, agree with this classification. Right. And we know cases in South Korea, but the South Korean case is more isolated in one city, Daegu. We know situation in Iran, we know situation in Italy, but still not in that level that it can be called pandemic.
So when does infectious disease becomes a pandemic? Could you give us maybe an example of the most recent pandemic in the world?
Pandemic means when it reaches unique situation, all citizens in the planet will be exposed to the virus within that defined period of the time.
Right.
So it cannot be classified pandemic, and even last case of the SARS infection also wasn't pandemic. So we are not in that level.
Okay, so could you give us some information about the measures being taken worldwide scale, and how does it, differ from the previous virus outbreaks?
So when we see the reactions of the countries, I think it's better we talk by country. So in terms of China's reaction, so China was more criticized for being a little bit slow at the early stage of the this case. We know there were not enough information what's happening in China's Hubei province, and I think China was also long, I think also delayed to inform World Health Organization and other organizations regarding about coronavirus infection in Hubei. So I think this actually caused a lot for China, and also I think delayed or even WHO's its own reaction. So however, after situation got worse, I think China's reaction was also except this delay, less information. What they did actually, the good early January of this year, I think they did great job by doing isolation regime and by taking certain actions to reduce to stop infection of the coronavirus, and also to isolate and to limit movement of its citizen. So for Russia and Mongolia, and even for Taiwan, Hong Kong, those countries are close to China. I think they also did good job. It's already 1 month, and we see that countries like situation in countries like Russia and China, Mongolia, or Taiwan, Hong Kong situation much better, because they taken also good actions. Compared to Italy or Iran, I think they were also not responsible, and also were not prepared. And we also see that even some countries' government structure, such as whether it's democratic country or Islamic country, is also playing a role. Situation in Iran shows that even we know also these countries under sanction. So these countries were not prepared, and situation got much worse in Iran. But in case of South Korea, we see that it's a more isolated case, and we see that within the city Daegu, the action, there were risk, there were infection, there were mortality, but we see that they now controlling, and the action they take now, it's good. So this is what I think.
So could you tell us about the mortality rate and the infection rate of the COVID-19 virus itself? How high is the mortality rate as of now?
So based on recent study of Chinese doctors who first tackled this disease, which is recently published on New England Journal of Medicine, it shows that mortality rate is between 1% to 4%. It was higher in Hubei, but overall in China it was around 1%. And the incubation periods around between 4 to 8 days. So the mortality rate is compared to some other viral infection, it's actually low. But those victims are actually largely people of old ages, and in terms of gender, it was more male. And those mortality happened for those people who had this combined disease, which is also played a role. So mortality rate is low.
So could you give us more information about the misconceptions around the face masks being used? Because of the COVID-19 outbreak, most people are, most companies are raising the prices, maybe using this as an opportunity. But is face masks actually that effective against this virus?
So face masks only prevents infectious people to spread the infection. However, because of incubation period of this virus, which is between 4 to 15 days, so it's very hard who's infectious and who's not infectious. So it's better everybody wears the mask every time. And of course, those special masks with special filters, which we call N19, also has to be used in areas where we have more contamination, more infection in circumstances such as hospitals or in laboratory.
Right.
So in normal everyday life, everybody should have face masks, and I believe face mask is effective, and it will protect you and also prevent infectious people to spread disease.
Okay, so let's get into our next topic about the coronavirus in Mongolia. So our next question will revolve around the topic of coronavirus and Mongolia. And Mongolia is in the high-risk zone of the coronavirus outbreak, so the government is taking every possible precautionary measures to prevent the spread of coronavirus in the country. So our first question is that you worked in the National Tuberculosis Program as a manager. So could you tell us more about there is that little we can do if the coronavirus starts spreading in Mongolia? So the government is taking a lot of precautionary measures, and how do you evaluate the measures being enforced by the government? And is there any room for improvements in case another such outbreak happens?
So as a specialist, I would say that the measurements and actions taken by government of Mongolia, by Minister of Health, I think it was relevant and also timely. And we see it's now almost 1 month since these measurements were taken, and we see we don't have any cases.
Right.
And so this is good. And this isolation, limitation, and also limitation of the closing of the border, limitation of certain flights to and from China, Korea, and Japan also playing role to Mongolia to limit and stop coronavirus. So it's a very good, timely action taken by Mongolian government, even though it's costing for our economy largely.
Right.
So it was a good, timely action.
So is there any room for improvements, for example?
Of course, there's some room for improvement, because as I mentioned, I used to work for a National Tuberculosis Program manager,
right.
And I know that in terms of a TB incident, Mongolia is very high in terms of prevalence. We also have one of highest prevalence within Asia Pacific region. This is because we have issues with infection control, issues with certain legislation, issues with treating and preventing people from tuberculosis. So this means if this issue stays on after this coronavirus, there will be also possibility for tuberculosis, even for this the viral infections to continue be big problem for Mongolia. We know that even before coronavirus, we had huge issue with flu and cold, and we know there were season where we have all schools and kindergarten has to close. So from coronavirus, COVID-19, I think we have to learn a lot, and we continue to do this good job in fight of tuberculosis, in fight of other infectious disease. For example, in Mongolia, we don't have a legislation which actually allows those infectious tuberculosis patients to be isolated. We have these patients who would drop their treatment even though they're infectious. We have these alcoholic people who also would drop and disappear into community even though they're infectious.
Right.
But we know in many countries, even in USA, in many countries, they have legislation. If these people drops and TB treatment during the stage of the infectious stage, they have to be isolated and they have to be arrested. So this kind of action and legislation needs for Mongolia. And all Mongolian hospitals and family doctors, they also have to have this triage, where whoever visits
right.
for a flu, cold, or for cough symptom, they have to be met even outside of the facility, and they have to put masks, and they have to be directed without delay to get diagnosed to the right doctor, TB doctor or cold and flu doctor, so that they could receive treatment, diagnosis much faster, because our study shows that, for example, for tuberculosis, we have big delay of the diagnosis, because even patients have the symptoms, they takes a lot of time, lot of days to get diagnosed. This means until that, which is almost 50 days. So within these 50 days, since they seek health care, for these 50 days, they still spreading the disease. This means we have to learn what we learned from coronavirus fight. We have to implement these lessons
in other infectious disease.
Yes.
Right. So since we're on the topic of the Mongolia's health sector at this moment, is funding from the government enough to give quality and accessible service to citizens, even without such infectious disease outbreaks such as coronavirus? And actually, when can our health sector do their own research and improvement, maybe lab researches on themselves without additional funding from the government?
So this is a very good question, and this is also a very big issue. For example, National Tuberculosis Program, mostly funded by Global Fund. So government funding is very low. Government only pays the wages of the staff and some other costs. But most of the drugs and laboratory equipments and laboratory tests are procured by Global Fund.
Right.
And I think it's also same issue for organization which fights HIV and sexually transmitted disease, and also for organization which fights flu and cold and viral infections. So most of our funding comes from the outside, not from the national budget. This means the Mongolia needs increase its budget and also improve capacity of the staff who's in this field, and also improve the technical equipments of the laboratories. For example, we know that there's the government decided to build a laboratory which we call the Biosafety 3 classification laboratory.
Right.
However, this laboratory was started in 2014, but after 6 years, it's still not completed because of not enough budget being allocated. So, for example, government has to finish this building, and this laboratory has to be in use.
Right.
Especially, when we're fighting this coronavirus.
So why is there lack of funding from the government to the health sector? One would think that is one of the most important sectors for a country to, invest in. Why is there so little, equipment of the hospitals to treat patients, maybe?
So the health system financing is a very big issue in Mongolia. For example, a recent study shows that only 10%
right.
of the cost covered by the health insurance, national health insurance, and 30% is covered by government budget, and 60% is covered by the patients themselves. This means the health system financing is not working well. We know that there is cases that health insurance agency, there's corruption case, and there is issue with procurement, and there is also issue with drug pricing, drug quality. So there's also issue with governance within a health system.
Right.
So this issue is actually really has to be tackled. Without this, the health system's efficiency against infectious disease, especially in this case, in extreme cases such as in COVID-19, it will not be effective. That's why we need to really improve budget allocation, also procurement, and reduce corruption within health sector.
Okay, so our last question on this part is that coronavirus is taking its toll on the international economy. So how is this affecting the Mongolian economy?
So I'm not economist, but I
Right.
can say that Mongolian economy is actually almost 90% dependent from the Mongolia's commodity export to China, such as coking coal and copper and other products.
Right.
So I think we're losing every month now almost 300 billion tugriks. So it's 300 billion tugriks. How much money? It's actually Mongolia's whole 1 year health budget is actually 700 billion tugrik. So this means every month we're losing half of our health budget.
Right.
So if this continues, I think the funding of the health and education system will really suffer. There will be budget deficit. However, there is good sign that China is already tackling this issue, and
Right.
we see that the business is almost back now in China. Many factories now started working, and normal life starting in China. So this will be also have good impact for Mongolia's economy, and so we're looking for good.
Okay, so hopefully this issue will be tackled soon in China.
Yes.
And let's get into our third topic about the coronavirus and vaccines and treatment. So although the spread of coronavirus is high at the moment, number of people who are being cured and treated is also increasing with that number. And lastly, for our topic, we will talk about the vaccination and treatment of coronavirus. So before starting this, I would like to ask that during these stressful times like this, fear looms over communities, and using this opportunity, people and some companies cause mass panic among the population for their own good. So how is the populism related to coronavirus in the international level, and how is it affecting the populism in Mongolia?
So we see that also COVID-19 and these issues having also playing a role, a certain role for populists. And we see that many Western European countries now demanding free movement of within European Union.
Right.
And we know many countries such as Russia was blamed for fake information about COVID. They blamed USA to be responsible for this disease. This
Right.
kind of populism having a role within media. But I think this has to be tackled. Good thing is that Mongolia is limiting fake news and populism within
social media
platforms. Yeah. And I think we have to fight without populism, otherwise it will have not results.
Right. So let's get to our topic about the vaccination. And could you tell us about which nations are conducting research and actually starting the possibilities of treatment and production of vaccines?
Mm-hmm.
And how are the people who are infected with the virus are being treated?
Mm-hmm. So we see that many countries now working to produce vaccine for COVID-19.
Right.
We know Australia is working on that. We know China and Japan working on it. But in terms of scale, it's almost $35 billion worth market, the vaccine market around the world. And we know there's the biggest companies are actually Glaxo of UK and Sanofi of France and Merck of the Germany and Pfizer of the USA. They are the main four players.
Right.
We know the Glaxo now already working with China. They helping Chinese government to produce vaccine. And we know Sanofi is also working and other companies working. However, problem is that many companies will struggle to make a profit by producing vaccine.
Right.
In previous cases, during SARS and Ebola, many vaccination companies actually it cost them more. So because of this reason, we know that World Health Organization also doing fundraising, almost $1 billion their target. And we know that Bill and Melinda Gates Foundation, they also working to fundraise. to fund to produce vaccine. So soon I think we will have vaccine, but vaccine itself actually also not good solution. It's because most of the victims mortality is happening among the old people, but vaccinating old people will be difficult. It could be very good for the young people, but for old people there is issue of vaccination because its effect is low compared to the young people because of the old age and certain issues. So this will be also issue, and but the best one is the prevention, having the mask and washing the hands.
So how are people being treated actually?
So regarding treatment, antiviral drugs, they are similar to each other because viruses are similar to each other, and we already heard that some countries using anti-HIV drugs to treat COVID, and some countries using drugs which was used for Ebola. For example, in Japan, the Japanese Fuji company is now already doing trial. They have their own drug which is they used for to treat Ebola. It's having also good impact. In USA, they're also doing a clinical trial. There is another existing, actually, already registered antiviral drug, which they use it to treat other viral infections. So they both having good impact for COVID-19. So this means there is existing drugs, and they can be actually, used to treat this infection, and it's already treating it. And also there is some initiatives, some companies in China, Japan, and Australia also working to develop certain antiviral drugs. So I think soon we will have the
effective dedicated drug for coronavirus. Okay, so how long does it usually take to produce the vaccine and mass produce it and provide it to the global market?
I think it depends in which country, but we already heard that in China, Chinese companies already produced vaccine, and it's already got green light from Chinese government for clinical trial and for the general use. This means, because it's extreme and different situation. Normally, vaccination takes clinical trial and getting registered with American and EU drug organizations, drug regulatory organizations. It takes at least 10 years, 15 years. But this time, because it's an issue of worldwide, and I think there's ways to register and to start to produce and to use can require less time compared to the
previous
normal, circumstances. Yeah.
I see. So some very lethal viruses are caused by the cross-species transmission. So are there any proven facts about the origin of the coronavirus? Some say it came from the bats, some say it came from another animal. So is there any proven facts about that?
So I think now almost most of people who study this already agreed that it comes from the bat, and through the there's also the animal which is in the middle. It's called pangolini. It's also smuggled actually in China from its neighbors. Its meat, I think, is worth almost $3,000, 1 kilo. And I think it's one dish in restaurants costs $350. So it's mostly food for Chinese rich people. It says it's very good for the heart. So I think this is the other two animals who caused this disease. So most people who do study on this origin of this virus, I think already agreed origin of this virus. And it's also very important for Mongolia. In Mongolia, we have this animal called this mammoth, which Mongolians also believe its meat is the magic meat, but it also causes the certain disease. We call it tarbagan, but it's called in English mammoth. So this also lesson we should learn from Chinese, and we should stop eating this
Using
animal.
exotic animals. Okay.
Yeah.
So thank you for your time today. Unfortunately, that is all the time we had for today. We will see you next week with more topics and news. Have a nice evening. Goodbye.